recording? All right. Thank you so much for joining me today to talk about functional medicine and opportunities for regenerative medicine in PRP, in ozone, stem cells, and peptide therapy. These are things that can make a huge difference in people's lives, help their pain, help their general overall wellness. When we don't feel good, we don't feel like doing anything. And pain can affect us in so many different ways. But first, let me tell you a little bit about myself. I'm Trevor Hausauer. I'm a family nurse practitioner. My practice is here in Fargo, North Dakota, and is Valley Vital Medicine. I have been a nurse practitioner now for a little bit over 5 years. I got into functional medicine because as I was growing up, I had a brother who was disabled and spent a lot of time spent a lot of time in doctor's offices with him and with my family. And as a part of that process, we got experience to a lot of different types of medical providers. We had positive experiences and negative experiences. And I figured out that as I got older, I really wanted to make a positive difference in people's lives in that type of a situation. So I went to nursing school and started out in the ER and the ICU, treating chronic disease, treating acute illness as well as injuries, and got a ton of amazing experience. But the question that I asked myself as I was there was really, how can I help prevent those people from getting to this point? Because our medical system is, for the most part, broke. We have a epidemic of chronic disease that is breaking our medical system. And when those people who are on all these medications have significant problems at home, or things get worse when they're not watched consistently or often enough, or just the medications cause problems, then they end up in the hospital. And so I decided, you know what, to try to help these people, I want to try to get outside of the hospital. And so I figured that becoming a nurse practitioner and working with these people is my next best option. And as I was going through my nurse practitioner schooling and learning about medications and learning about patient cases, one of the things that I would ask myself as going along is, well, is this going to prevent that person from ending up back in the hospital? I was lucky enough to have a clinical instructor who actually had her own business as well. And as we would go through those clinical case studies, she would tell us, she would give us an idea of, if there was something that we should add or remove from our workup of whatever the patient case was. And at the end, she would add in that sometimes we might want to consider this, and that this sometimes was magnesium or ashwagandha or rhodiola or some other adaptogenic herb. And really made me think and say, well, where in the world is she pulling this from? And so she turned me on to the Institute for Functional Medicine. And the Institute for Functional Medicine has a pretty amazing, robust website. I spent a lot of time there really learning about what that was and the framework for thinking. And it just sucked me in. I drank the Kool-Aid, as you would say. And ever since then, my passion has really been about functional medicine, because I believe that this is the best way to help people overcome their chronic medical concerns. So functional medicine is defined as a medical practice or treatments that focuses on optimal functioning of the body and its organs. Usually this involves systems of holistic or alternative medicine. The best way to paint a clear image of functional medicine is to demonstrate how it differs from conventional medicine. So how I explain it is conventional medicine asks what disease the person has. Okay? Functional medicine asks what person has the disease. So think about that for a second. We're not asking what disease a person has and then matching a pharmaceutical up with it. What we're asking is what person has the disease and what are the roots that are causing their disease. So I'm not saying conventional medicine is all bad, not by any means. It's fantastic for acute problems specifically, and also when we have problems where we need surgery. You know, if we have a heart attack, don't take me to a functional medicine doctor. I need to go and either get a stent placed, or if I get run over by a bus, please don't take me to a functional medicine clinic. I need to go get evaluated. I need CT scans and x-rays and the labs and surgery. So I'm not saying that conventional medicine is all bad, not by any means. But what I'm saying is for chronic disease, I don't think it's the best. So we need to take into account individual genetic and environmental research to obtain a deeper knowledge of each person's biochemical individuality and health status. And so when we do that, functional medicine really takes that place, and it can really be considered to be personalized medicine. So that's a little bit of a background of what functional medicine is. But now let's talk a little bit about why we're here today, right? So we're here today to talk about pain. What causes pain? Anatomically poor circulation to ligaments and joints. So joint space and ligaments have poor circulation. That's part of the reason that they have problems with a lot of pain. Aging further decreases both circulation and oxygen utilization. Okay. Trauma produces localized edema, inflammation, and depolarized membranes, which causes a further localized decrease in circulation. So in other words, when you get hurt, all of the things that help us to remain healthy get worse. Decreased circulation from trauma means a further decrease in local oxygen utilization, which is secondary to a decrease in oxygen and nutrient delivery. And this results in increased localized acidosis, so more acidotic state because we have less oxygen and more free radicals are produced in that area. So that hurts and perpetuates the cycle of injury. So let's talk about treatment options. And first of all, we'll start by comparing to conventional options. And again, I am not saying by any means that these are bad, but that we at least need to talk about them. So the first conventional option is physical therapy. In addition, we look at surgery, braces, cortisone injections, supplements, other pharmacologics, ibuprofen, Tylenol, narcotics, acupuncture, exercise, chiropractic adjustments. All of these are great, and they all have their appropriate place. But then we need to ask ourselves, well, what are the risks to be considered, particularly with surgery? So surgery itself is not a guaranteed cure. Oftentimes you need to have revisions. It could be months or years later, but oftentimes they need to be redone. The damage that's done in surgery is irreversible. It costs a lot. There can be a lot of pain. The risks that you sign for your informed consent include infection and death. And let's not forget about downtime and the recovery that comes after surgery. which can take weeks to months before we are able to recover from some of these surgeries. So now that we have an idea of what we're comparing ourselves to today, today we're going to talk about our regenerative options for treating pain. And particularly, these are options that I offer at my practice here at Valley Vital Medicine. But before we talk about those in particular, I want to address diet. Because diet is an important component when it comes to pain. And this should be of consideration by anyone who is dealing with chronic pain. And in particular, we need to think about removing inflammatory foods. So the main foods that cause inflammation are fried foods, processed vegetable oils, grain-fed and other processed meats, refined flours, sugar, alcohol, dairy, trans fats, gluten. And then on top of that, we throw in other possible food sensitivities that any individual might have. Now, I don't think most of your orthopedic doctors are probably telling you this, but if you're having a lot of joint pain, you probably should think about doing a gluten-free diet, or doing an elimination diet of any sort might really be a good idea. So think about diet and the inflammatory repercussions as it comes along with pain. All right, so let's move on. Next, we're going to talk a little bit about ozone. So ozone, what is it? Ozone is what I call super oxygen. Okay, so oxygen is O2. Right? Everybody knows that the oxygen that we're breathing has 2 molecules of oxygen. To make ozone, I use pure oxygen, which I run through a generator, which then runs electricity through that oxygen to break those O2s into O1. When we break oxygen into O1, those molecules are incredibly unstable and they come crashing back together, forming O3, which is known as ozone. Okay, so that's what ozone is. Now, ozone was discovered over 100 years ago, and there was a guy by the name of Nikola Tesla who patented his first ozone generator in 1896, and in 1900, he founded the Tesla Ozone Company. He was the first one to ozonate olive oil, and he was an incredibly famous person. He's one of the 100 most famous people in the last 1,000 years. Now, since then, the use of ozone medically has been done hundreds of thousands of times. In fact, it was quite popular until the advent of antibiotics, because ozone also has antibacterial, antifungal, antiviral properties to it as well. So, is ozone safe to use? Over 3,000 medical studies have been published on the use of ozone, and more are being done all the time. In my opinion, I think the safety is particularly unmatched. In the research that has been done on ozone therapy, they did a comparison and found a complication rate of only about 0.0007%. So that means 1 out of every 150,000 patients who are treated have a complication. That's a pretty impressive rate of safety, and is actually safer than aspirin. So what does ozone do in an injury? What we do is we actually inject the area of injury with a solution called Prolo-Ozone. Prolo-Ozone involves additional nutrients as well as an anesthetic called procaine. And when we add these in, it repolarizes the injured cell membrane to improve circulation. It reduces inflammation and edema. It reverses acidosis. It supplies the mitochondrial energy that we need, helps with glucose utilization, helps stimulate circulation, improve oxygen utilization, and stimulates cytokines, which are needed to start our body's own natural healing response. Okay? So, again, let's break this down. What does it do? It stimulates increased circulation, improves oxygen utilization, increases free radical control, decreases acidosis, decreases inflammation, eradicates infections, and delivers mitochondrial nutrients. Pretty impressive. Okay? So what are the results? The result is that the conditions that interfere with the healing process directly are being corrected. Stem and blast cells get the oxygen they need for the ones that are actually already there. Pain is reduced. The healing process in that area is rejuvenated. It stimulates the body's own regenerative potential and therefore complements other regenerative treatments to include stem cells and PRP. So what can somebody expect when they decide to utilize Prolo-Ozone injections? You can expect an immediate decrease in pain, soft and hard tissue regeneration, a true cure of most chronic injuries and degenerative processes because of how it works. Now, the response to treatment does vary from person to person, but most people need about 3 to 5 injections to really get the results that we're looking for. With these injections, there's very minimal pain and really no side effects. The value of Prolo-Ozone is that it actually results in the correction of the pathology, or in other words, what is wrong with the disorder or what is causing pain. So pretty cool. I love ozone. Ozone is one of my favorite therapies. Let's move on to PRP. PRP is another pretty amazing therapy. And I use this along with ozone all the time. So what is it? Your body has its own healing factors that are located in your blood. So in order to get PRP, or platelet-rich plasma, what we do is we draw your blood. I then place your blood in a special cartridge and place it in a centrifuge. So the centrifuge spins it around super fast, which results in the red blood cells all going to the bottom. And so what's left on top is the plasma and a little buffy layer, which is filled with platelets. So platelets are responsible for clotting your blood, right? So that's where most of you know them from, and why we use aspirin for people at risk of heart attacks, because it decreases our risk of clots. But it also plays a significant role in healing. Your platelets do. So what does it do? Once the platelets are in the area that are being treated, they break down and they release growth factors, okay? Which are compounds that help your cells repair and renew, triggering your body's own healing process, okay? So this works through an inflammatory process, okay? So this is very important. Anybody who is thinking about doing PRP injections really needs to be off any anti-inflammatory medications or supplements for 1 to 2 weeks before and after the injection. And as I mentioned, when I do PRP, I often combine it with ozone because they are synergistic. In other words, they make each other work better, okay? So what are the benefits? This or PRP can be used to treat tendonitis, joint injuries, arthritic pain primarily. We will see a decrease in pain, healing of the tissues, and improved mobility. I recommend 3 injections of PRP to get maximal results. Each of these would be spaced about a month apart, okay? Periodically, you might need a touch-up. in 6 months or a year, you might want to get another PRP injection just to touch things up. But overall, I've seen this be quite successful. What about safety with this? This is incredibly safe. We're using your own body's tissues, so we're not worried about donor issues from somebody else. We're not putting something in your body that is not supposed to be there. When would PRP maybe not be right for you? It might not be right for you if you have a low platelet count, if you have anemia, cancer, or infection. Okay, so those are some of the reasons why PRP might not be right for you. All right, so let's move on. Peptides, peptide therapy. Not very many people have heard of peptide therapy, and peptides have been around for a long time actually, and they're really cool. There are a lot of different types of peptides. But first, what is a peptide? A peptide is a short chain of amino acid. In other words, what does that sound like? Proteins, right? So a protein, though, is a longer sequence of amino acids, and peptides are shorter, okay? There are over 7,000 naturally occurring peptides in our bodies. They are natural compounds. They're already in our bodies. So for example, insulin is a peptide, okay? Today, we're going to talk about one peptide in particular, thymosin beta-4 is what it's called. Now, there are lots of other ones and some other ones that can actually help with tissue regeneration as well. But thymosin beta-4 is one that I am most familiar with right now and is the one I'm currently using with my patients. So thymosin beta-4 is a hormone that's secreted naturally from your thymus gland. The thymus is responsible for regulating the immune system and tissue repair. And that's what your thymus does. Did you know you got a thymus? Some people I talk to don't even know they have a thymus. They're like, what? A thymus is responsible for my immune system? And we have all these immune concerns, and nobody's talking about my thymus. Yes, your thymus is responsible for your immune system and also tissue repair. So thymosin beta-4 has been found to play an important role in protection, regeneration, and remodeling. Okay? So it works particularly well in injured or damaged tissues. It gets prescribed for acute injuries, surgical repair, people that were once injuries that have accumulated patients that were once athletes that have accumulated multiple injuries over their lifetime. It can be taken after a cardiac injury for better healing of the tissue in the heart. It is best prescribed to be taken once daily for 20 days. Okay? We can repeat that cycle if we need to, if we didn't quite get the full benefit we're looking for. Or it's actually not a bad idea for people to consider doing a prophylactic use or just a periodic use of thymosin beta-4. Use it for a 20-day cycle 2, 3, or 4 times a year and spread them out. So thymosin beta-4 is typically found in both types of muscles in the human body. Skeletal, so the muscles that are required to move, so like biceps and quadriceps, and smooth muscles, so muscles such as those in the heart and the vasculature. So when damage to your tissues occurs, the thymosin beta-4 is upregulated, okay? It is released in the body, again, naturally. This is what your body does to help you heal from trauma. In the process of healing from injury, it also helps to reduce scar tissue and improve your flexibility. It also has potent anti-inflammatory properties. So what are maybe some of the hiccups to this? Well, you need to inject it, so some people may not like that, but it's a simple subcutaneous injection that is done similar to insulin, okay? So what are the benefits that people see when they use thymosin beta-4? It calms muscle spasms, it improves muscle tone, increases exchange of substances between cells, encourages tissue repair. It helps maintain flexibility, reduces inflammation of tissue in the joints. It encourages growth of new blood cells and tissue, increases endurance and strength, and prevents the formation of adhesions and fibrous bands in muscles, tendons, and ligaments. That's a pretty impressive list, I would say. And so this is something that I think I'm going to be incorporating in my own health journey, just periodically, to maintain my own health. So is it safe? This is super safe. There's virtually no side effects. The only thing that people generally will see is maybe a little bit of irritation at the actual injection site. Okay? It's possible for the body to make antibodies to it. This is really rare and unlikely. This has a specific lock and key level specificity. So it causes a very specific desired effect and is well tolerated. There are no adverse drug interactions that have been observed. There are no side effects, as I mentioned, other than some irritation or possible burning sensation at the site of injection. So again, can be used 2 to 4 times a year for 20-day cycles for recovery and tuning up your system. So can be used as a standalone therapy, can be used by itself, or we can use it in conjunction with these other therapies that we're talking about today. Okay? Now let's talk about stem cells. Stem cells get a lot of press. And yet I think a lot of people don't really know what stem cells are. Okay? So stem cells are microscopic in size, super small, but they are blank cells. In other words, they're capable of becoming any different type of cell in the body. And it depends on where they are put. For example, stem cells can take on the role of skin cells, muscular cells, nerve cells. It all depends on where they're put. Stem cells are highly intelligent and adaptable, and they innately know what they're needed to do to heal or repair in the body. They can also identify harmful tissue and remove it. Stem cells are the body's highly intelligent and adaptable built-in healing system. So, what kinds of tissues are used to get this from? Okay, there's a few different ones. There is bone marrow, there is adipose tissue or fat, and there's embryonic and umbilical cells. So these embryonic and umbilical cells in particular can differentiate into more different types of tissue. The adult stem cells, which would be the adipose and the bone marrow, occur naturally in the body, and they provide a natural mechanism to repair tissues that you already currently have. Okay, so everybody has their own stem cells. But currently, stem cell therapy is the most advanced treatment, in my opinion, that we have available to us in functional medicine. So, again, what is stem cells therapy? It is the use of umbilical or the patient's own stem cells to treat or prevent a disease or condition by helping the body repair its own damaged tissues. So stem cell treatments can be done through injections as a simple in-office outpatient procedure. The California Stem Cell Agency said, in their opinion, that there's no limit to the type of disease that can be treated with stem cell research. Now, there are a ton of options when it comes to treating stem cells, and in some cases, they're even using it to treat things like multiple sclerosis or cancer or heart disease and some of those things. I'm not talking about that today, but that is not what I specialize in. How I use these therapies is for tissue regeneration, primarily in the shoulder and the knees, okay? So again, bone marrow, adipose, and umbilical. Okay, so following removal, those cells go through a process to concentrate natural growth factors that are found in the cells and then get injected back into the patient. Okay. So why is this important? We already talked about this a little bit, but they have many unique characteristics, uses, and healing abilities, which make them ideal for treatment therapy. They have the ability to become another type of cell with a specialized function when they get divided. So they can become a red blood cell, they can become a muscle cell, they can become a ligament, they can become a nerve cell. Our body stem cells are also abundant in natural growth factor hormone, which accelerates the body's natural healing response. This naturally lowers your pain and results in less need for pain-killing medications. These cells also reproduce rapidly and continue dividing even after long periods of inactivity, which is why patients start experiencing reductions in pain, improved mobility, and better overall functionality in generally one treatment. Okay. Pretty impressive. So the first successful bone marrow transplant, which is a type of stem cell therapy, was done in the 1950s. Okay. 1978, stem cells were discovered in human umbilical cord blood. The process of in vitro fertilization was realized in the 1990s when it was discovered that stem cells could be taken from human embryos and grown inside of laboratories for reproductive purposes. And this is where some of the controversy over stem cells originally came from. Now, in 2006, they found that adults have their own stem cells that can be used to repair damaged tissue. So this hasn't been around all that long as far as our more recent understanding and research, and things are changing all the time. But we'll talk a little bit more in a minute about umbilical cells and why I think those are the most adequate, the best source of stem cells that we can get. So the National Institute of Health outlined some primary goals for future stem cell research. So this is what they're looking at as we go along here. And what they're trying to figure out is how undifferentiated stem cells, in other words, they don't have a name, become different cells. They don't know that. We don't know, I don't have a full understanding of how that happens. They want to determine how stem cells can turn human genes on and off, because they can, and we don't understand that. They want to learn how to predictably control cell proliferation and differentiation. So in other words, how they grow and become different types of cells. They want to investigate more uses for stem cells. So as I mentioned cancer and birth defects and some of these things. So some of the other future goals is to use stem cells for to avoid organ transplants or surgeries in treating things like macular degeneration, spinal cord injury, stroke, burns, heart disease, diabetes, osteoarthritis, rheumatoid arthritis, cancer. So ongoing research still going on, but pretty impressive just the same. So a number of benefits have been identified and associated with stem cell therapy. So what are they? We have increased collagen production, better functionality, range of motion, flexibility, and even sleep quality. Okay? Decreased nerve damage, faster healing time for injuries or wounds to heal, reduced risk for future injuries and pain with less need for medications. It aids in the regeneration of new heart and blood vessel tissues and helps heal skin wounds to prevent the formation of scar tissue and reduce hair loss. Again, not all of these that I'm using, but these are the benefits that have been seen with stem cell therapy. So let's talk about our treatment approach a little bit. Treatment protocols vary depending on the tissue and the condition that is being treated. There are two main types of stem cells. There are hematopoietic stem cells and mesenchymal stem cells. Okay? Hematopoietic stem cells show promise in treating vascular and cardiac disease and injury, such as peripheral vascular disease and cardiac disease. Right? Mesenchymal stem cells show promise in many different areas, including orthopedics, and neurologic diseases. So mesenchymal stem cells are specifically what I use in my practice, alongside what is called placental matrix. So placental matrix has the scaffolding proteins, or the ability to create the tissues in the joint space to prop it up and give it space. Okay? The following conditions can be improved with stem cell therapy: orthopedic, cardiovascular, healing wounds, neurodegenerative, diabetes, autoimmune disease, blindness and vision impairment. But again, today we're talking about orthopedic injuries. So again, orthopedic injuries can utilize fat mesenchymal stem cells or umbilical mesenchymal stem cells. These have the capability of differentiating and forming new orthopedic tissues that make up your muscles, bones, cartilage, and tendons, ligaments, and adipose tissue. Okay? Current research concludes that stem cell injections have been found to reduce chronic pain, heal stubborn injuries, improve functionality, and return patients to their normal routine, sometimes as soon as a week, but it can take 6 months, and we continue to see improvements even up to a year. Okay. So the stem cell therapy itself, as I mentioned, is a simple outpatient procedure. For the type of treatment that I am doing, there is no surgical procedure. A patient would come in, we would do an evaluation, make sure that you're the right fit for stem cells. If that is the case, we will determine then that that is the course that you would like to undergo. And if that's the case, we will order them. I'll get them here at the office. I'll have you come back in. We'll do a simple injection either into your knee or shoulder, or if there's somewhere else that we need to look at injecting them. And we'll have you out the door. And that injection process really will probably take less than a half an hour or so. So it's a simple, quick procedure. So again, stem cells from your own body, now this is my opinion, are not used in my office. Okay? I believe that samples that are taken from your aged body are not as rich and potent as the young, healthy tissues taken directly from an umbilical cord. Okay? So that's where I get the stem cells from that I use. Now, some people ask, well, what about the baby? Okay, right? And that's a valid concern, and it's a question that I had too. So these umbilical cords are obtained by the company only after consent from the parent and after a healthy birth. Okay, there is no harming of any babies. There is no use of anything that would be unhealthy or would give a negative consequence to any of these children. So this is super important, and was something that was super important to me, and really gives me a lot of comfort about being able to provide this to my patients. Okay. So by using these umbilical cord cells, it helps us to provide an optimally healthy and a super high concentration of cells that we need to get the response in your body. The stem cells are received, so this is the company that I use now, Predictive Biotech. So you can go ahead and look them up if you want to. I use them because their standards are second to none. Their cells are minimally processed to preserve what is important in their and get this, FDA registered lab, okay? This is not some willy-nilly lab that is doing weird things. They are registered with the FDA, and the FDA has oversight of what they're doing. They have incredibly high standards. This provides me with a peace of mind knowing that I'm providing the very best and highest quality stem cells and optimal cell counts to my patients. The stem cells are directly injected into the joint. And again, I combine this with placental matrix so that we are putting all the ingredients around the stem cells that we need to get the best result. Okay. So again, the entire process only takes a few minutes. Most patients report feeling relief from a single treatment. Note that many experience improvement in a few weeks, but benefits can be seen 6 months up to a year later, okay? So what is the contraindication for this procedure? So this is important. The contraindication, or in other words, it's not right for you, is if you've had a previous organ transplant, okay? The reason is because they are on medications to prevent their body from rejecting those organs, and we are not going to mess with that. So if somebody has had an organ replacement, this is not the right thing for them, okay? We could still do ozone, but we cannot do stem cells. So what are some additional benefits? Some things that we may also want to consider. Number one, we're lowering costs by eliminating continuous drug use. So think about the prescription drugs, the opiates, the anti-inflammatory medications that people are using all the time. We are reducing the cost of that. We're reducing side effects that are associated with those. We are possibly and hopefully and likely replacing invasive surgeries. So stem cell therapy provides the potential to replace many risky, costly, invasive surgeries. Complications associated with risky surgery can be debilitation or permanent body changes that we just didn't get the surgery result we were hoping for. Or we can use this alongside surgery, okay? So inflammation and scarring is a result of most surgeries. So I would recommend that we could consider adding stem cells even to help recover from a previous surgery, or again, think about adding in peptide therapy. So these alternative therapies are perfectly suited for functional medicine as they work to heal your body naturally. I am confident that these therapies in functional medicine will be the most effective route of treating chronic concerns as we go into the future. Through a comprehensive treatment plan, we can provide optimal care and treatments for patients. And there are a lot of patients out there who are already benefiting from these therapies. So we have reviewed a ton of information today, and I hope that you have learned a lot. I think the possibilities for stem cells, particularly in the future, seems to be basically endless. So the best way to figure out if these therapies and stem cell therapy are right for you is chat with your functional medicine doctor. So some of you maybe you come to my clinic, and I'd be more than happy to visit with you about these if you have any particular concerns about anything. So let's see here. Thank you so much for joining me. I have loved having you here for my webinar. I really appreciate you. If you are interested in these therapies or anything else that I do, the best way of getting a hold of me actually is through my website. My website is valleyvitalmedicine.com. And in there, there is some different resources on these therapies underneath the tab called Services. And in the upper right-hand corner, there's a tab where it says Work with Trevor. And when you click on that, have you fill out a health assessment and also register for a discovery call, which is free. And we just chat about whether what I do is the right fit for you. So again, thank you so much for joining me today. I am going to go ahead and